It has been confirmed that there are 2 cases now in England.
The patient had been in and out of hospital for issues unrelated to the coronavirus.
The hospital said that a patient has died.
Our sympathies are very much with the victim and their family.
This patient is believed to have contracted the virus in England.
The coronavirus is the biggest threat this country has faced for decades.
COVID-19's relentless spread has reached this Glasgow care home. A suspected outbreak of coronavirus taking 13 residents in a week.
I've developed mild symptoms of the coronavirus.
We have just been told by Downing Street that the Prime Minister has now been moved to intensive care, that his condition has worsened.
The latest daily death toll has risen by a record 980 people. That's higher than Spain and Italy's worst daily death tolls.
Well, I think one of the reasons our death rate looks so high is because of the way we collate these stats.
Now we know, according to these new statistics, that actually the real death toll around then was 11,413.
Okay, so I read this article in the FT and I found it really interesting. In fact, it was quite shocking. Apparently, 41,000 people have died from the coronavirus in the UK. I mean, that's shocking, 41,000 people. And it's far higher than what's actually reported in the official numbers. To put this into context, yesterday it was reported that 17,332 people have died in the UK from the coronavirus. Now, what this figure counts are people that tested positive and then died as a consequence of the coronavirus within UK hospitals. It doesn't count those people that were not tested for the coronavirus or died outside of UK hospitals. And that's why this figure is so significant. So what the Financial Times did was they extrapolated the data taken from the Office of National Statistics up to the 10th of April. And they came up with what they describe as a conservative estimate. And that's 41,102 people. I mean, it's shocking. I mean, we know that the death rates in the UK were underreported. This has been widely reported in UK news broadcasts. I mean, for most people, the fact that deaths have been undercounted in the UK from the coronavirus is not surprising. This has been in the news every day. In fact, whenever they mention or report the numbers, they also say and state that these are only the deaths that have occurred in UK hospitals. And there have been lots and lots of news reports about how the COVID-19 virus has been ravaging elderly care homes. I mean, this type of news has become a daily feature, so it's nothing new, we know about it. But it's just so shocking to see this figure. I mean, 41,102 deaths. That's higher than anywhere in the world. But the thing is, it really isn't when you think about it. I mean, deaths have been underreported everywhere around the world. The UK is actually quite transparent in the way that it reports its data and the death rate and the deaths that have been caused by the COVID-19 virus. They've been very clear and very precise, but they've also told and been open about how there's limitations to what they can report because there are only so many testing kits available. So not everyone who's died from the virus has actually been tested for it. Now, the fact that deaths are being underreported doesn't mean that something sinister is going on. Obviously, in some countries, there are some issues. I mean, North Korea, for example, doesn't have a single case of coronavirus, which is highly improbable. But a lot of the time, it's just because the authorities in those countries just don't have the capacity or the infrastructure to be able to count or trace or track the virus. In countries like India, tests are quite expensive. They can't afford to physically go and test the sheer volume of people that may have actually contracted the virus. And as a result, we really don't know how bad the virus is in emerging markets and other countries. So why does the death rate actually matter? I mean, why should we care about the death rate? Well, the death rate of the coronavirus is a lagging indicator. It's about 4 weeks behind where the virus really is. The analysis provided by the FT, for instance, suggested that the virus peaked on the 8th of April in the UK. This suggests that the lockdown measures that have been put in place have actually been highly successful. However, you could also argue that we don't really need to know the full extent of how many people died, because you can draw similar conclusions from the deaths reported by UK hospitals. I mean, basically, what's reported by UK hospitals is a large stratified sample of what the rest of the country is experiencing. However, I think it's important to track these deaths, and there are a number of reasons why. Firstly, there's the moral aspect. People who have died from the coronavirus, who are victims of the coronavirus, deserve to be recognised as victims of the coronavirus. Also, it brings a lot of closure to the relatives and loved ones who have lost people to this horrible virus. The other reason is psychological. If we don't appreciate how severe this virus is, then change will never happen. The virus has reframed our minds about healthcare and about how we tackle these types of risks in the future. I mean, it's been widely known that the UK NHS is massively underfunded. I mean, if you compare it to other countries. And maybe this will raise awareness about this issue and improve the funding from the NHS so that when times of crisis do hit like this, that they're better prepared. Overall, perhaps this might lead to a better quality of healthcare in the UK. Finally, maybe it will raise awareness on how we can take better care of the elderly. We obviously do not have the infrastructure in place to look after an aging population. And this is important to put in place now before it grows. The other thing which kind of makes me a bit annoyed, I've heard these really disturbing ideas suggested by people that we shouldn't waste economic resources on trying to save those people who are at the end of their lives anyway. I mean, this is ridiculous. The elderly are people who have paid their taxes all their lives. You know, if anything, they are the most entitled when it comes to healthcare. They have contributed so much to our country. They are the reason why we have an economy in the first place. And although I understand that we need to protect the economy for the future and that people's lives are at stake and that jobs are going to be lost as a result, I don't think that we need or we should sacrifice the elderly. It's true, they are nearing the end of their lives, but it doesn't mean that their lives have stopped. And so we should give them what they deserve: good healthcare and good care.
We shall defend our island, whatever the cost may be. We shall fight on the beaches. We shall fight on the landing grounds. We shall fight in the fields and in the streets. We shall fight in the hills. We shall never surrender.